Hey everyone, you probably heard that Medicare is going broke, and in 2036 the trust fund is going to be running dry, and all of a sudden your Medicare is going to go away. What is actually fact and what is actually fiction? Today we're going to break that down in today's video. So let's start with the truth. Yes, there is financial issues, but no, Medicare is not going away in 2036. I'm going to break down exactly how Part A is funded, how Part B is funded, exactly all the changes that are occurring and what has happened in the past, so you understand what is going to happen over the next several years with Medicare, the rising costs that you need to be aware of, and there is some burden that Medicare beneficiaries will have to carry if legislation is not passed. The importance of just getting involved and understanding, just so you understand from a financial standpoint what you're going to be faced with in upcoming years, and then not to be worried Medicare isn't going away. So when experts say Medicare is going insolvent, they're really talking about specifically about Part A of Medicare, which covers the hospital, skilled nursing, hospice. And you guys have heard me talk about on other videos. If not, you can go into some of the basics of Medicare videos that we do, Medicare Made Simple workshops that I provide and things like that to understand the full detail of Medicare. But Medicare Part A is really when you're thinking about the hospital and everything attached to the hospital. Part A is funded by a trust fund, which we're going to break down here in a second exactly how does the trust fund work. And projections show that this fund could be depleted by the year 2036. So if you hang on just a few minutes, I'm going to explain what is happening to deplete that money and then what is going to offset that so it's not depleted, or if they don't change things, how it can be depleted. So by depleted, that doesn't mean necessarily bankruptcy. Obviously, we've not seen our nation go bankrupt. The Great Depression, obviously we had problems in the 1930s when the Great Depression occurred, but bankruptcy of a nation like America is probably not going to happen. We're going to explain exactly the details. Even if the trust fund runs low, Medicare would still pay about 89% of hospital claims using the money still coming in from payroll taxes. So understand here in a second, I'm going to talk about payroll taxes, your FICA taxes that you've paid all your life through Social Security, Medicare. FICA taxes fund Part A. And so when you have worked 40 quarters or 10 years or longer, you've funded in enough FICA taxes into the Part A system, in a sense, by your eligible payment to fund your Part A benefit. So when we look at how much am I going to have to pay in Part A, if it were to decrease down to 89% coverage, then that means basically this 11% would have to be made up either by the Medicare beneficiary, or there would have to be some changes I'm going to talk about in just a second as well. You'll still get coverage, just not at 100%. So if this does occur and you begin to go down and it goes down to 89% like projected, you're going to have issues, and there's going to also be the chance that 100% of your coverage for Part A, beyond the Part A deductible that Medicare has, you're going to have issues by paying higher cost. So great news is, and it's kind of sad news, but reality is Congress typically, when this occurs and we see a decline in funding in the trust fund, Congress steps in and usually passes legislation to balance the budget, or balance the bill, balance the fund. And usually what that means is they're gathering money from other buckets of the government. So we see Social Security, Medicare, we hear about these buckets of money running out. And in reality is Congress steps in because a couple of things there, just on a political note. It doesn't matter if you're standing on the left side of the fence or the right side of the fence, or you stand dead in the middle when it comes to your political views and things like that. Congress is put in by we the people, voting for people to put somebody in the House of Representatives. And so what happens is Congress realizes 25% of the population are seniors. So if they don't take the vow of voting for the constituents, then all of a sudden the constituents like you are going to vote them out of the position in Congress. So there's a balancing act for Congress to a lot of times hide these bills or hide the funding for balancing bills in other funding and legislation that's being passed. We just had a huge legislation that was passed, the big beautiful bill by Trump. There was a lot of hidden stuff in there. So his original bill had a certain list of items in there, and then along comes legislation that says, hey, we will vote for this if you allow us to pass this in with the bill. So a lot of times that happens in the political arena when it comes to Medicare. So just keep that in mind. Congress is going to step in most cases, and resolve and balance when it comes to the trust fund and balances of deficit, or there's always never, in a sense, a surplus in the balance of things, but typically they're going to be equal or less than enough money, and when it begins to deteriorate, they're going to fund that back in through congressional. But let's dive into how exactly is Medicare funded. We talk about the FICA taxes, but also how's Medicare funded for Part A and Part B services, and where does that money go? So here's where the real fear often comes from. Most people don't understand how Medicare is financed, so I'm going to break down exactly how Medicare is financed. One, Part A is funded again by payroll taxes, FICA taxes. Part B is funded by general taxes plus your Part B premium. So right now we're in 2025, it's $185 for a standardized Part B premium. And then based on IRMA, if you have a higher income by an individual or married couple, the higher your income, the more Part B premium you pay. So, but most people, if you're making married and less than $212,000 combined income in a household, you're going to pay $185. Anybody that's above that as a married couple, you're going to have an adjustment in your Part B. So one, it's the general taxes that are paid in by all of us paying taxes, plus your Part B premiums. Part A, again, you paid that through FICA taxes for 40 quarters or 10 years, and that allowed you to be eligible for Part B, or Part A, excuse me. So Part D is funded the same way as Part B by general taxes and then a premium. And then you'll also see in Part D, the drug benefit, people will have a cost share or copay amount. So you may have a medication that's $200, but the copay amount is $10. And there's a portion of what Medicare regulates the carrier to fund in, and then now the pharmaceutical company. And if you guys have not dove into like some of our training about the Inflation Reduction Act, I would encourage you to find those videos, watch those so you understand what's changing in the realm of medications in Part D and how it's lowered down to $2,000 max out of pocket. And there's a lot of changes that have happened there. But Part D in general is being funded by general taxes that we're paying in plus the premiums that you're paying. That means most of Medicare, Part B and D, don't have a trust fund that just runs dry. It actually runs off the general taxes plus what you pay in. They're funded every year automatically and can't technically go broke. So that's great news. A lot of times there's a lot of fear mongering that's pushed out through the media, online. There's a lot of people that are throwing out hooks to get you to kind of bite into something and believe something is just a myth. We'll be back in just a second. I'm going to break down a couple more things for you. So again, when people talk about Medicare going broke, they're usually talking about one part of Medicare. And we're going to talk about why the trust fund is shrinking. So there's a trust fund that is paid in to compensate for Part A services, and that is shrinking. We're going to talk about that. So why is Part A in trouble? Because it depends heavily on payroll taxes. When people work, a portion of their payroll check or paycheck goes directly into Part A trust fund. But with a shrinking workforce, this is a concern, an aging population, and rising healthcare costs, it begins to shrink that trust fund that's being paid in through payroll taxes. So keep this in mind. One of the biggest things over the last decade, and we're coming still into what they call the baby boomer movement, is there have been 10,000, 11,000, depends on who you ask. They'll say 10,000 to 12,000 people per day turning 65. So what's happened historically in the past is, mortality rates have shown the average American, male is going to live to this age, female is going to live to this age. And now all of a sudden what's happening is the baby boomers turning 65 are projected to live much longer. Now the average age for most seniors is like 84 years of age, where it used to be 78 and then it used to be 74 years of age. So people are living longer. Therefore, the money paid in by the taxes of those seniors now is having to be expanded out longer, plus the population of the people paying in taxes. So if you just kind of keep in mind, like the longer people live, the more money the government has to supplement in to pay for the portion for the trust fund. The second thing is, the reality is, and the sadness of healthcare, is there's rising cost. One of the things, and this is a caveat just to keep in mind, is and like the reality of how broken our healthcare system is. You know, if you are under 65 and you, like our insurance from Jennifer and I, if I go to the hospital and I have anything done outpatient, like a MRI or CAT scan or PET scan, and just go to the hospital and it's done through the hospital, or I go to a freestanding service where I can go in and have like a lab service that does MRIs, CAT scans, PET scans. If I go to either one of those, if I go to the freestanding location, the cost for us to be able to have an MRI is about $750 out of our pocket. If I go to a hospital, the cost can double, if not triple and quadruple. So the reality is, what they say is, because the hospital has more employees and the funding to fund that, from specialists to the radiologist reading it, to the different people that are going to touch just that MRI, it escalates the cost up. As opposed to if you go to a freestanding clinic to have an MRI done, you typically will have one person doing the MRI, one doctor reviewing it, and then somebody calling you back with the results. There's less people. Now, that's sad, because in reality, what's happening here should be happening over here. You should be able to send 1,000 people to a hospital because it's a larger facility and facilitate the same steps as a freestanding clinic that does an MRI. That's just one example of how it's affected us. And then for the Medicare beneficiary, the reality is the costs dealt with hospitalization, because hospitalization has just gone haywire. There's driving costs up and to the right. And then when it comes to specialized care, chronic illnesses, medications, Part B medications and things like that, there's a driving cost up and to the right. And so there's regulations now being put in place, and part of this is through the Inflation Reduction Act. But the reality is the driving cost is depleting the trust fund. We'll be back in just a second to go over some more important information. So I often say in business, it's money in, money out. The reality is the money coming in now is less, it's the money going out is less or more than the money coming in. Sorry, it's a tongue twister. So what's going out is more than what's coming in. So in fact, the Medicare trustees originally projected insolvency by 2031, but recent changes like improved payroll revenue pushed that date back to 2036. So that's good news, but it's not a permanent fix. In just a second, I'm going to cover exactly what happens if we hit 2036 without real reform. We're going to be in up over our heads and a lot of costs if reform has not happened. I'm going to go over that with you in just a second. All right, so let's imagine that we're in 2036. Congress hasn't made any changes. The trust fund is now technically insolvent. Would Medicare stop paying your hospital bills? Well, the answer is no. But you'd likely see delays in payments to hospitals, a reduction to coverage to about 89% of approved expenses. Now, this is projections, so don't hold me to this fine line and in 2036 you wake up and go, Kelby was wrong. But the projections now are saying if insolvency, in a sense, were to occur, they're not going to be out of money. They're just going to reduce what they will cover, and that will drop to about 89% of the cost. Okay, so you're going to incur additional hospitalization costs either through original Medicare, or it's going to be pushed out to the Medicare Advantage plans, or Medicare supplements are going to come along and compensate Part A services. You're going to have some cost out of your pocket to cover this if something hasn't been changed. In fact, there's a pattern when trust fund depletions dates start getting close, Congress makes changes. Reality is Congress runs by the vote, and the voter has the power to be able to say, if you don't make changes, we're not going to vote for you. And people that have a job, that love their career, and a lot of times politicians want to stay in Congress forever. The likelihood of them changing the term limit, sadly, may not ever change. But the reality is these guys get in a seat, or gals get in a seat, and they want to sit there forever. And one of the ways that they do that, and the reality is, it revolves around how the money is allocated when it comes to Social Security, Medicare, and and again, the population of 25% of the population being seniors, you have a huge swinging factor in the votes of who gets to stay in Congress. From 1982 to 2001, depletion dates went from 5 years out to 28 years. So you see here, Congress, we hear it all the time. Every 5 or so years, 10. I always say there's a 5 to 7 year window of everything happening. Usually 4 years, a new president comes in. Within the first 100 days, there's a lot of legislation changes. And then within the first year, you start hearing about the insolvency of Medicare or the changes and regulation things that need to occur with Social Security. It's always tied to this narrative of fear that they're going to run out of money. But we've seen the depletion dates be pushed from 5 years to 28 years, all because of timely legislation fixes. The real fix is ignoring Part B. What almost no one talks about is Part B, and this is where the real risk lies. Okay, Part A has always been pushed out, fixed. Congress passes the legislation, pushed out more years. So the insolvency, we've never seen it happen. It always gets pushed out. Now they're projecting 2036, and if not, 89% of the cost, and somebody's going to be eating the other 11% pie of that cost. But reality is, historically, we've seen it pushed out to later days. But the real problem is Part B, and I'm going to be back in just a second and talk about the real risk and your real exposure when it comes to Part B and how the government works when it comes to running out of money. All right, so since 2016, I'm going to read a little bit of information to you and talk to you through this process. Spending on Part B has outpaced Part A. It's now the biggest driver of Medicare costs, but because it doesn't have a trust fund, it's easy to ignore. Okay, so we hear about the trust fund with Part A. With Part B, we do not. Again, it's paid for by the general taxes plus your Part B premiums or Part D premiums. This means the government has to spend more taxpayer dollars each year to keep it funded, and that hits everyone, not just Medicare recipients. So I often say I pay taxes in so Medicare beneficiaries can be eligible for Medicare and Social Security. Your money you paid in for Social Security and Medicare goes in a generalized fund, and if you have services that are rendered hospitalization-wise that accumulate to $5 million over 20 years of you from 65 to 85 and you die, the reality is you've not paid in enough taxes to cover the cost that you've incurred, okay? So if lawmakers only focus on Part A trust funds, they'll miss the larger sustainability problem hiding in plain sight. So what can you do? So what does this mean for you? Stay informed, which I've been talking about. Stay informed. Understanding Medicare's funding gives you peace of mind and helps you vote smart. So as an American, we have the opportunity, we're given the right to vote. I tell my kids this all the time. Voting matters for you. I say stay informed, be educated, listening to people that are going to educate you. There's a lot of great people out here providing content like myself that's going to educate you, make you aware, keep you up to date, make you informed. I always say this, and you hear me in my videos, will say this often. People that talk about like Medicare Advantage is the villain, and Medicare supplements is like the perfect option. I come from a balanced middle and educate people on both options, because what we found is with Medicare beneficiaries, they like to know their options, and both are a great fit if you understand how the plans work and how a Medicare supplement works. The benefits of that, how Medicare Advantage plans, and I call them golden handcuffs, but like how prior authorization works. If you're educated and you understand your plan, then enrolling into either one is fine if it meets your needs. So staying informed. Another thing, don't panic. Medicare has faced funding issues before, and Congress has always stepped in. So a great thing about our nation is it values seniors 65 and older. We realize that seniors are one of the biggest trending parties to be able to vote, to have a voice, to make a difference, and you've contributed for 65 years. Maybe you've worked since you're 20, so 45 years of contribution towards taxes and funding and support and living in the community, paying property taxes and all the things involved with working a job and taxes. Don't panic. You have a voice. Congress does respect that voice and who you are, but Medicare has to realize, and you have to realize that, staying informed about what's going on is very important for you. So don't panic. Don't stress out. Live your life. Congress will step in, legislation will figure it out and push the football down the field in front of you to resolve the insolvency issue. They have always done that. Third is use your benefits wisely. Take advantage of preventative care and resources that reduce future costs. In just a second, I'm going to walk you through exactly what you can do to really take advantage of how Medicare covers preventative services and additional things that you may not be aware of. So, additional benefits. One of the things that is so important for every one of you to realize, regardless of what health plan you go on to, is taking advantage of preventative care services and being aware of kind of like the diagnosis of where your health is. Medicare Advantage plans will call this continuity of care a lot of times. Medicare in general calls it continuity of care. Medicare Supplement, people that just enroll people in Medicare Supplements don't really talk about this as much as if you're talking to an agency like us, we talk about continuity of care, preventative care services. Now, that's going to cover things like your annual wellness exam, bone mass measurements, colorectal, prostate screenings, immunization, flu shots for you ladies, all your well woman physicals, mammograms, and things like that. And then also now, if you are pro-vaccination or you're a non-vax person, they're going to cover all vaccinations. Any and all vaccinations now, as of this year, are covered by Medicare or your Medicare health plan. And that's going to include like COVID vaccinations. In years past, when I got into this business, people, if they had shingles and had to get a shingles shot for vaccination, had to pay that through Part B. There was a cost incurred with that. Now that's covered. So if you are like, I don't know, I've got this thing going on. If you have a high risk for cancer, there's preventative screenings for cancer. It doesn't cost you anything. For your heart, any major illness or disease, anything that rise healthcare costs up and to the right, there's going to be preventative services. Talk to your doctor about this. Say, hey, I want to be set up on my wellness exams and preventative services to ensure that you're catching things at an earlier stage. An ounce of prevention is worth more than a pound of cure. If you catch it early, it costs you less money. If it costs you less money, guess what? It costs the health plans less money, regardless of your health plan. It costs them less money, therefore it helps suppress the money that's going out to cover medical costs, which is huge. So the last thing is talk to a Medicare expert. Some of you don't have a licensed agent or agency like us to be able to work with. You're kind of pushing that down the road and you're trying to figure out who to turn to. Make a decision. We do an excellent job from start to finish of educating people, holding their hand through the process, identifying what your problem is, covering the concerns, and really what we like to say is making your life easy by making Medicare simple and then helping you in the enrollment process. You can click below, schedule a time, let's have a conversation. You may have conversations based on this video. You may have other problems and situations that you're occurring. Having somebody guide you through answering those will eliminate the stress, make your life easier, less stressful, take the confusion out of Medicare, and then simplify things to you. But you need to make a decision and take action today. Talk to somebody that can help you. We'd love to be that person. We'll talk to you soon. Hey guys, so I'm Kelby Hightower. I'm the CEO or founder of Medicare Hub. We're an insurance brokerage that specializes in Medicare health plans. I've asked you to be able to take the next step by clicking below, scheduling a time, but also you can click below if you want more information about Medicare and you want to be guided through a deep dive of how Medicare works, all the health plan options, and any question you could think of. We have about an hour-long Medicare Made Simple on-demand workshop that I walk you through everything you need to know about Medicare, along with being able to have a guidebook that you can fill in, take notes, and be educated. It's going to answer every question you can think of. If you're on an employer plan, should you come off? What health plan options are? How does Medicare work? What are the rules and regulations that are going to eliminate me from maybe accessing service, and all types of different things that I'm going to cover in this deep dive. Click below. You can register for both. If not, schedule a time for us to talk. We'd love to be able to guide you through making your life easy by making Medicare simple.